needs to be contextualized in the backdrop of a hospital delivery system that was above its normal census at this time. So those added 15,000 cases of COVID were really challenging for hospitals. And there was a great deal of work to make sure that those hospitals had the support that they needed to take care of not just patients with COVID, but many, many other patients as well. And then the second point, when you look at hospitalizations and cases, is that this time around with Omicron, we saw what some people call the decoupling between cases and hospitalizations, that even though there were many, many cases, fewer cases were hospitalized versus earlier surges like the Delta surge, where you see the bump right before this far right peak, where you see the hospital number much closer to the reported number of cases. So that decoupling is really important. It recognizes that Omicron has not been as virulent as other strains of COVID, that it hasn't led to as many hospitalizations, as many ICU admissions, as in many deaths as prior strains of the virus. That is encouraging news, of course, on the one hand, but it hasn't always been the pattern with COVID, and we shouldn't expect it to be moving forward necessarily. Next slide, please. We've talked to you for a long time about models. We've been using models in California. We have various models that stand on their own, and then we have an ensemble or a composite model that we update regularly and post and share publicly so people can see where California is sort of predicting we might go. This model, one, you don't need to remember the name, but the lemma model, one of the reasons why I like it and chose to share it with you today is because it's a model that uses hospital admissions and numbers to really understand the complexity of what's happening in our community with everything from transmissions to the level of hospitalizations that we can anticipate. It's been a good and accurate model and has helped us quite a bit. And you can see here that we climbed the green boxes are the actual numbers, and then the blue line is where we believe the hospitalizations are heading. And if you look at today, we're not far off from where the model is, and the projections moving forward are the continued decline in hospital numbers. We often always see that the rate of decline slows after it initially is high, and that's not unexpected, but the idea that we'll continue to see reductions in numbers is very important for the decisions that we're making now. We've always talked about how we need to keep the hospital system well supported and protected so they can take care of all the needs of Californians. And this gives us a little bit more confidence that that's where we're heading. Next slide. So one key point to make is that this approach that we've had has always adapted to the changing conditions of COVID, and that we continue to learn to deploy the mitigation strategies. What do I mean by mitigation strategies? Things like masking, things like using isolation, things like testing. And we learn to use these mitigation strategies in more precise and smarter ways every day and every month that we move forward through the pandemic. Next slide. And part of this has really led to what we like to talk about as multiple layers of protection against COVID. And you can see here, and at different moments throughout the last 2 years, we've emphasized different parts of this set of layers. First, as a real baseline foundation, we've told people if you can spend time outdoors, do it. We know the outdoor fresh circulating air helps reduce transmission. And then, of course, stay home when you're sick. We talk about common sense measures, and that's one of them. And I think Californians do that much more now than they did before the pandemic. We also talked about how large gatherings are places where spread is more likely, and avoiding them when possible is important. We've emphasized this at different times when transmission rates were different, more than we did at other times, but it's still an important tool. We've learned more and have begun to emphasize more the importance of improving indoor ventilation, that air quality, circulating air. We talked a lot around the holidays, keep your window open, keep a door open. Improvements in filtration efforts can really make a difference. And this has been and continues to be a core strategy here in California. Wash your hands, focus on wearing a mask. We've learned a lot about the value of masking, how it is an important tool, and that it's a tool that works when we need it. And it's really helped, and I'll show another slide in a moment about some of the data that's specific to California that's demonstrated at times in the pandemic the value of masking. And then nothing new to any of you, the get vaccinated and if eligible, get boosted as a real primary tool. And we've seen the impact of getting immunized on the most severe outcomes of death and hospitalization, but also an important distinction between the level of infections among those who are vaccinated and boosted versus the unvaccinated. Sure, we've seen people who have gotten vaccinated also get infected. Thankfully, they don't get nearly as sick and same risk of having a bad outcome, but we have seen a difference even in those infection rates between the vaccinated and the unvaccinated. So all of these collectively are those layers of protection that have helped California get through the last 2 years and have important and important to families, the outcomes that we've experienced throughout. Next slide. So I want to get into masking. And I know there's a lot of discussion on masking. There is a tremendous amount of energy and focus, and it's important. It's something that Californians have leaned on. And I will just say, and I should have said it earlier, we have always depended on 40 million Californians coming together in large part to keep moving forward our state, not just health protection, but so many other areas of our economy, our schools, our businesses, and it has taken tremendous work. In California, we have really worked hard to make sure that we empower and inform people the valuable tools, those layers, and masks is one of them. And just a couple of weeks ago, California shared a study done by our own California Department of Public Health that looked at the real life experience with using masks in public settings throughout California, and the impact of those masks. And what the study showed, it was published by the CDC just recently, was that versus no mask, wearing a cloth mask reduced your odds of getting COVID by 56%, surgical mask, 10% better. And those respirators, those N95s, KN95s that are becoming more commonplace, did a tremendous amount to reduce the odds of getting infected if you do wear a mask. So the idea that as a tool, masks do what we hope they would do. Of course, this depends on how well you wear it, how often you wear it, not just the type of mask, but we know that some masking is better than none, and that respirators provide superior protection. And we know that this is a tool. And like every tool, you need to use it prudently. You need to use it at certain times more than other times. And it's important that we in California continue to lift up the evidence, not just that they do what we hope they do, but that they're a tool that should be used at certain times more than others. Next slide. So just to put in context the masking decisions at the state, I just want to remind you where we've been since the beginning of December, when I stood on the first day of December in the Central Valley with the governor to announce the identification of the first Omicron case here in the United States. The case in San Francisco, we identified one. Shortly after that, we started to see signals in wastewater surveillance systems across the state that potentially there was community spread of Omicron. And then on December 10th, we announced that we would put in place a temporary, and I'll emphasize temporary, public indoor masking requirement. We moved from what was strongly recommended into the requirement. And what were the trends at that time? We saw cases climbing really fast, and the spread was faster than ever. That effective reproductive number, the R effective that we've talked about throughout this pandemic, was higher than it had ever been. And we already knew that hospitals were above average in their census. They were taking care of lots and lots of patients, not just with COVID, at that time Delta infections, but also other needs that had been built up over 2 years of many people not necessarily accessing the care that they needed, and now having to seek hospital level care. And then at that time, the level of uncertainty was really high. We didn't know if the therapeutics worked against Omicron. We didn't know how well the vaccines worked. We didn't know if kids or older Californians were going to be more heavily impacted. The level of uncertainty across the globe was high. On January 5th, the day we decided to extend at the time, the 1 month temporary public indoor masking requirement, we decided to extend it again now through February 15th. We were still at a time when cases were nearly 3 times the peak from January 2021. We didn't know exactly how high it had gone, but we now know that January 4th, we had over 152,000 reported cases of COVID in the state. We know that spread was still expanding, that we hadn't begun contracting, that for every one person infected, they were likely to infect more than one other Californian, and that hospitals were struggling. They were doing the work that they always do. Staff were coming and continuing to fight the good fight against COVID to keep Californians as healthy as possible, but they were having to deal with so many other factors. Staff were becoming sick and having to be out, and the level of uncertainty at that time was still high. We were beginning to learn how Omicron behaved in our communities, but we weren't quite with the level of confidence that we even have today. So on February 7th, we announced a move from a requirement to a strong recommendation for indoor public masking. The conditions on that date were cases that started to come down significantly. I showed you earlier the data of cases dropping from January 14th till now, and that was true on the 7th. Spread was beginning to contract. We had seen that the effective reproductive number drop well below 1, meaning that when one person was identified as a positive case, they were infecting fewer than one other Californian. And that means that we would start to see contraction of the total caseload, and that would, over time, continue to drop. And very importantly, hospital staffing was improving. The COVID census was coming down, and the total census overall in the hospitals, which is a number, the last time I was with all of you, we emphasized that had started to come down, and our level of uncertainty had dropped as well. We felt more confident that we understood how Omicron was going to move through our communities, how it was going to impact. And it's not to say it doesn't have impact. That would be the wrong message to send. It's been great impact. People have lost their life to this nasty virus, and that continues. That said, we understand a lot better where it's heading and what's happened over the last many weeks. And that is why, next slide, please. We are prepared after tomorrow to allow the guidance for public indoor settings for vaccinated individuals to move from a requirement to a strong recommendation. And it's important to know that we're moving just from a requirement to a strong recommendation, not to a recommendation, and not that masks are optional. We're still strongly recommending that people wear them in public indoor places. And on top of that, for the unvaccinated, there's still a requirement to wear them in public indoor places, in healthcare settings, in schools and childcare settings, in long-term care settings, in jails and prisons. For both vaccinated and unvaccinated, it remains a requirement. And I'll remind you that just the way California has always worked, 61 local health jurisdictions, partners through and through this pandemic, that those local requirements may be additive to the above state requirements in certain places. Next slide, please. So I want to just take a moment and talk about schools. I know this has been really important as a pediatrician, a father of four, something that I talk a lot about at home with my own kids, in my community, with many of the leaders throughout the state, not just in health and public health, but beyond, about this important conversation. Next slide. So I want to just highlight that through the leadership of so many in the education community, among our elected leaders, counties, cities, school districts, the state, there's been a winning formula put together that mitigation and the outcomes of this year push towards. We have put in over 31 million Californians who've stepped up to get vaccinated. When adults get vaccinated, that supports the kids. When kids get vaccinated, that supports the other kids and their siblings. And this has been a tremendous work. We still have work to do. I'm not dismissing that, but it's important to celebrate the success of the vaccination effort here in California. Yes, still equity gaps, still work to do to get more, our youngest Californians, vaccinated at rates that we want to see go up, and we really hope and expect will go up as more time is seen to confirm the safety and the effectiveness in the vaccines, and more families and caregivers and children get their questions about the vaccine answered by trusted messengers in their community, their healthcare providers. We really are leaning in to get this number up. $850 million invested in school safety protocols throughout the last 2 years that have made a difference, whether that's staff who are aware and able to do the important work to keep schools safe, or improvements in ventilation, setting up testing programs, just a tremendous amount of work. $23.5 million high quality masks sent to school staff. 6 million tests, almost 6 million tests administered at schools to date. Those are state-supported school testing sites, many others that are county-supported or school district-supported as well. And then a tremendous amount of work to get over 15 million at-home tests distributed to schools, many of them, the vast majority, just since the middle of December when Omicron began to rear its head. So this set of mitigating factors, these approaches that we've gone over today and many, many other times, leaning in, supporting schools so that they are world-class and as safe as any when it comes to COVID transmission. I think something that we have done and plan to continue to lean into. Even as other changes happen, the presence, the availability of these important tools, not just only when we need them the most, but to keep us confident in where the data is moving, where communities and settings are moving, is going to be key, and something that we continue to be committed to. Next slide. And this winning formula plays out in the national data as well. We have 12% of the students in the country here in California schools. And we have experienced less than 1% of school closures this year. You can see that throughout the nation, that there are pockets where many, many schools have closed. And that is directly related to how we have managed and supported the schools through two really large surges this year. Tremendous challenges, and all the while focused on keeping schools safe, keeping schools with students in person. And this less than 1% is something I think so many Californians can be proud of. Through the discourse and dialogue and the discussion about what to do next, the value of what we've done, I think this slide speaks volumes to the efforts that we continue to work towards. Next slide. So our approach has been focused on humility. The governor often says humility, or being humble, is one of the most important things we've all learned throughout this pandemic. Being flexible and being focused on the evidence. California has never been afraid to lead on schools. We are stubbornly focused on safety, implementing the evidence, and our experiences inform these policies. we were even ahead of the CDC, ahead of the American Academy of Pediatrics, implemented universal masking at the start of the school year, a key feature in helping us achieve what we've done. We've adopted smarter testing policies, including increasing the use of antigen and over-the-counter tests. I just went over some key data on how many have been sent to schools throughout the last many weeks. I think a real deep commitment that not only is California one of the only states that can do what we've done, but that we have done it is important. And then constantly working to be a state that learns. We talk about, I often talk about how I want California to be one of the states that learns the most and the fastest, that we have not been afraid to move away from some mitigation approaches in favor of other ones that are more strongly supported by the data. We've done that by shifting away from physical distancing as a key strategy, or even our move away from individual contact tracing to group contact tracing in some school districts has been important. Not that this is the only place where we end up. We will continue to move according to the science, according to the information we have, to ensure that Californians are doing all we can to keep our schools safe for students, for staff, for families, and communities at large. Next slide. I also just want to talk about what is informing our approach. We've talked about some of this already. We are prioritizing heavily in-person instruction. There's no substitute, particularly for vulnerable populations. Schools are not just a place where young people get educated. It's where many receive their meals. It's where many receive specialized services. It's where many depend on important social interactions. And not just prioritizing in-person education, but prioritizing safe in-person education. We must continue to work to ensure that low risk of catching COVID in schools that we've seen throughout this year, it's totally achievable, that we maintain that for our staff and our students. We continue to work with school and education leaders, public health leaders across the state to make sure we're staying current and doing what we can to create this environment in schools. And that masking requirements were never put in place to be there forever. It isn't a question of when, but it's not a question of if, it's a question of when. And I'll get into a little bit of that in a minute. And that we will always remain prepared to adjust with the conditions of the virus. We demonstrated that with Omicron. We did it with Delta. We will do it again if there are future variants or if any of the current variants that we've seen before rear their heads again. Next slide. So where are we going? So based on our data, it's reasonable. I shared a lot of good, important data that's directionally coming down and coming down fast, that we're getting to a place where we can relax the statewide masking requirement in school. We will today not make a change. There'll be no change in the masking requirement, but on February 28th, full 2 weeks from now, we will reassess the data. What does that mean? It means we're going to look at information on case rates, confirm what I just showed you that we believe is going to happen, which are the case numbers will continue to come down, test positivity will come down, hospitalizations, both adult and pediatric, will come down, and we're watching vaccine rates. We will use this opportunity to remind students, families, that this is a great chance to get vaccinated, that vaccines are free, safe, and effective, that they do a lot to help protect not just the individuals, but the community at large. And we're going to look at all of these different factors as well as trends around the globe and the nation, ensuring that we aren't seeing upticks and increases down the road, and that on February 28th, we anticipate being able to share what the next period of time will look like, and with some specificity, give a date when the masking requirement will move to a recommendation. We also know that this takes time, that not just the school community, but communities at large, families need time to prepare, need time to have conversations in their communities about what local conditions might apply, whether added protections are going to be considered, and that those can be implemented safely. The one thing that has been important throughout our entire response, especially, but not only in schools, but especially in schools, is that we don't make hasty decisions. We will take the collection of information together to make a decision that is good for California broadly. We also know that local communities are having these conversations today. And although the state sets an important bar that where people can't be less restrictive than the state, they can certainly begin to add layers of protection in their communities as they see fit and those conversations take them. So again, to emphasize that no change to school masking requirements now, and then on February 28th, coming together again, having assessed and reassessed the information to make an announcement as to where we will go moving forward. Next slide. And so, as I said, this reassessment looking in 2 weeks is not going to be about a single indicator. It's going to be about a composite look, things like cases, things like hospitalizations, vaccination rates. As I mentioned, vaccines save lives, but their impact takes weeks to make a difference. So we will continue to prioritize getting vaccine rates up in students and use this as an opportunity to encourage families to go forward and get vaccinated if it's something you've been considering. And then, as I said, following those national and global trends and understand their impact in California will be important. Next slide. So to wrap up, we hopefully have continued to lay out a science-driven approach that requires us to constantly evaluate all of these factors. And at times, that evaluation is going to be done in the context of a great deal of uncertainty and concern. And at other times, we will do that assessment with a lot more confidence in understanding where we are based on where we've come. And that it's not just one factor, but many, and directionality matters. Not just are you coming down or up, but that rate of rise or decline is also important. And that's where we've started, and that's what we will continue to do here in California. So with that, I believe that's the last slide. I think it is, yes. And I just want to thank you. I know that was a mouthful for me. I'm sure for you as well. I'm happy to begin taking questions.
The first question comes from Spencer Custodio, Voice of OC.
Hi, Dr. Ghaly. As always, we really appreciate you taking our questions. You hinted on it on the last part of this press conference, but you'd also mentioned that, state officials are hoping to get vaccination rates for students, for the younger Californians higher. I was wondering if you could preview a little bit for us before, the February 28th date. Is there like a certain threshold, say like 60% vaccination rate, before officials seriously start reconsidering the mask mandate in schools? And, how much has these state officials been hearing from local school departments or school districts that they really would like the mask mandate to stay? Thank you.
Sure. First off, we don't plan to, at this moment, set a threshold above which or below which something happens. What I think is the real opportunity today is to explain to Californians where we are with childhood vaccinations, that we have a long way to go, and to work with families and communities to get that number up. It is an important, one of the most important mitigation approaches that we've seen. And I certainly hope as a pediatrician that number goes up. But without sticking a number out there, we haven't set that number. I think right now, the point is that as we anticipate changes, now's a great time to get vaccinated. It's an important time to get vaccinated, and we encourage people to do so.
Next question comes from Kristen Huang from Cal Matters. Kristen?
Asked and answered.
Great, thank you. Next question comes from John Woolfolk of the San Jose Mercury News.
Hi,
Dr. Ghaly. Thank you. You had pointed to some of the school disruption data that the website Burbio hosts, but the data don't seem to demonstrate a clear connection between statewide mask mandates and outbreaks. Am I reading that wrong? I mean, the state of Florida doesn't seem to have any disruptions on them at all. The state of New York has about as many as California and has the same kind of mask rules or has had it. Same with Oregon and Washington and many of these other states. What are you seeing in the national data that suggests that a statewide mask policy is effective in preventing school outbreaks?
Yeah, I think a couple of things. First off, the data really says, it just identifies clearly where school disruption has occurred. It doesn't say that this level of disruption is attributed to this intervention or that intervention. It really just says this is the data and these are the facts. And I think the collective approach in California isn't just about masking, it's about so many other things. My entire section on schools started with the focus on building up the health and public health infrastructure in schools to be able to track illness, the investment in vaccines, the investment in testing on top of the investments in masking. So again, don't want anyone to think that it is the mask requirement that is the only thing that has driven the success that we've seen. I think it's the collection. And I say that with a bit of focus because so many people have spent tireless hours making sure schools are safe, not just focusing on masking. And that's a really important testimony to the work of Californians across. So, again, without saying, well, the approach of one other state or a set of states is better or worse. The connection I want to make is our work together on a number of different layers has made a difference for Californians keeping schools going.
Next question comes from Alex Michelson, Fox 11 News.
Hi, Dr. Ghaly. Thank you for talking to us, and I like your kids' artwork in the back. A question, though, you know that there are a lot of parents that are going to be outraged by what you're saying today, that are saying it's time to unmask our kids. They see images of the Super Bowl yesterday, 70,000 people, almost nobody wearing masks. They know that adults are going to be able to take off their masks. They know that kids, by and large part, do not have as bad of health outcomes as older adults. What do you say to outraged parents who say it is past time to unmask our kids, especially if adults can take off their masks? Why can't kids? Especially if we believe in the vaccines, which kids can now take, if we believe in the air filtration systems, and we believe in the mitigation efforts.
Yeah, Alex, thank you. And thanks for always being a fan of the kid art. Appreciate that. What I would say is, first off, I know and hear and listen to the frustration from many California parents. And I would say the message today, which I hope is clear, is today a change isn't being made, but in 2 weeks, confirming that the data continues to be where it is, taking the time to prepare and work with the school community and communities at large, that we anticipate making the change at that point. And that change is going to be one that I think will be met with a lot of excitement in some and a lot of fear in other circles. And so, Alex, your question, if I could say, is only part of the story in California. And we know that there are other voices that are to be heard and to be considered. And as we move forward looking and basing our decision in the evidence and information that we have, understanding that we will continue to prepare and continue to support schools to stay in person for all students, not just some students. And we know that there are many students who must come to school because that's where they get their education, they get their meals, they get other important services. That those are young kids with underlying conditions and concerns, people who've lost family members to COVID, that this is not a decision that we make lightly or in a hasty way. And we want to make sure that those local conversations are teed up for success as well. We know that in some pockets of California, there'll be a decision to maintain something even beyond when the state makes a decision to change. And in other parts, it will be an immediate change. And we want to, we've always let local conditions be an important driver in determination. So the point is, parents should not hear that we aren't making a move. We are taking a little bit more time to consider the information, work with our partners across the state to make sure when the move is made that we are doing it successfully and with communities empowered to continue to be safe.
Next question comes from Kitty Alvarado with KPBS.
Yes, hi. Thank you so much for taking my question. I was just wondering, people or health officials are treading really carefully when it comes to endemic versus pandemic. Is the state of California looking to update the entire pandemic safety plan in general and go towards more of an endemic route? And if so, what will that look like?
Thanks for the thoughtful question. And as the governor has alluded to, we are working hard on really updating how we move into the next phase. That what we're talking about today is part of that conversation. How do we approach the use of a tool like masking and other tools moving forward? And stay tuned. I know the team is working hard to make sure that when it is presented by the governor, that it is something that people can really understand, relate to, recognizes the successes and the work that we've done to get to this point, and gives people a sense, especially in the short and medium run, how we will work in California to keep Californians safe.
Next question comes from Don Thompson with the AP.
Good afternoon. A couple of layered questions here, if I may. One alluding to what you just talked about a little bit, as far as the why take a statewide approach when you've often said that this varies by communities, and do you expect it to have some sort of differentiated approach when you do roll it out, and based on what metrics would you be looking for? And then as far as what held up the decision that was promised today, as far as the key sticking points, for instance, with teachers unions, if you can outline some of those. Thank you.
First, on the first part of your question, the focus is going to be on being prepared and being ready. I think we have all learned that setting thresholds and setting and committing to a single point of data, a single point in time, sort of glosses over the need to continue working hard to be ready and be prepared. So California's plan, of course, we'll talk about data and data elements and their importance, but is largely going to be focused on how we stay prepared and ready and what Californians should come to expect. In terms of the decision here, I've said multiple times today that this is not a decision that we take lightly. It's not a decision that is a hasty one. It is not one that should only be left at the regional level. It's something that the state can continue to provide some important guidance on and important data to inform. But yes, in this case, there will be the ability, as there has been throughout, that communities that want to add additional layers of protection as they see fit should and can. And that the decision, as far as I'm concerned, is one that we have been thinking through and working hard on because of the data and the information, the recommendations, not just here at the state level, but taking into account recommendations at the federal level, the CDC still recommends masks in schools, masks in certain other places, that it's important that we take all of that into account. So alluding to other factors and points, I certainly appreciate the question, but will tell you that my concern, my team, our team's concern, our work with many others is looking at what information we have to help us understand where we're going to be going so we can make a safe decision for students and citizens of California.
The next question comes from Ali Tayden with EdSource.
Thank you. I was wondering if the statewide mask mandate drops, will individual districts still reserve the right to keep their masking policies in place? And if they do so, will they still be provided with masks?
So the commitment to continue and providing masks as the state has been is something that we're always is not linked to this decision or this or what happens in the next many weeks. I said, and this is not just true of masks, but true of tests, true of other supports, especially around outbreaks, that the state and local health jurisdictions will continue to play the important role that we have throughout the pandemic. Yes, local decisions are not just allowed, they're well supported. They are issues that help consider some of those local trends in the data, local trends in what works and what doesn't work in communities. And I think that will be, as it has been, an important feature moving forward, whether that's at the district level or the local health jurisdiction level. I certainly want to emphasize, because of my admiration and appreciation for local health leaders, those local health jurisdictions that are working hand in glove with districts and schools directly to make sure that not just outbreaks are managed